If your future sex life, confidence, and long-term health matter to you, this is your wake-up call. Most men break a few silent rules that quietly sabotage erections, sensitivity, and fertility, and they don't realize it until something goes wrong. Today on Stoicism Drive, we're laying out the 10 things you should never do to your penis, and what to do instead, so you can protect performance now and for decades. Stick around for number 10. Almost nobody talks about it, yet it can change everything you think you know about. Use it or lose it. Quick note: this is educational content, not medical advice. If something feels off, see a qualified clinician. 1. Don't ignore it. Your penis is a health barometer. Your penis doesn't exist in a vacuum. It's plugged into your circulation, hormones, nervous system, and mental well-being. When erections weaken or desire fades for no clear reason, that can signal trouble with blood flow, testosterone, thyroid, mood, or even the meds you're taking. There's a reason erectile dysfunction is sometimes called the canary in the coal mine. The vessels that feed the penis are small and can show vascular problems earlier than other places. How this shows up: erections feel softer or less reliable. Recovery between rounds takes much longer. Morning or spontaneous erections become rare. Desire dips even though nothing in your relationship has changed. Do instead: start treating changes as data. Track what's happening for 2 to 4 weeks. Sleep, stress, alcohol, workouts, meds, and the quality of erections. If the pattern is trending down, or if you notice pain, curvature, discharge, sores, or blood, get checked. Early insight means simpler solutions, less guesswork, and better outcomes. 2. Don't DIY growth hacks. No miracle creams. No sketchy gadgets. If a claim sounds like a late-night infomercial, gain inches overnight, it belongs in the trash. Home-brew tricks like pouring acids, oils, or vinegar, or using makeshift pumps and weights, can lead to burns, infections, scarring, curvature, and erectile dysfunction. Jelqing is a classic trap: forceful, repeated stretching that creates micro tears. Over time that can mean plaques, curvature, painful erections, and reduced rigidity. The other trap: improvised constriction rings, metal nuts, bottle rings, zip ties. Once swelling starts, these can become impossible to remove without emergency tools. You do not want an team and a power saw anywhere near your genitals. Do instead: if you need a constriction ring, buy a medical grade one with a quick release feature and follow the instructions. Never sleep with it on. If you're curious about pumps or traction, talk to a clinician about evidence-based devices and safe protocols. There's no safe at-home shortcut to permanent length or girth. Focus on function, sensation, confidence, and skill. 3. Don't neglect hygiene, and don't overdo it either. If you're uncircumcised, remember the simple 4-step routine: retract, rinse, dry, replace. That prevents smegma buildup and balanitis, inflammation or infection under the foreskin. But your skin is delicate. Aggressive scrubbing, harsh fragrances, and strong detergents can cause irritation and micro cuts that sting during sex and invite infections. Do instead: use lukewarm water and a mild, unscented cleanser. Pat dry. Don't sandpaper the area with a towel. If you can't fully retract the foreskin, consult a clinician. Options range from topical therapy and small devices to circumcision. Make self-inspection routine. If you can't see the skin, you can't monitor the skin. 4. Don't ignore pain, sores, discharge, or blood signals, not nuisances. Pain isn't just in your head, and blood is never no big deal. These can indicate STIs, UTIs, stones, dermatologic conditions, or, rarely but seriously, penile cancer. The tragedy is delay. Men often avoid care out of embarrassment, only to face more invasive treatment later. Do instead: seek care promptly. If you feel judged, switch providers. Your health comes first. Early treatment is simpler, safer, and far less disruptive than waiting. Be clear and specific about symptoms, onset, severity, triggers, and any sexual exposures. Direct information helps clinicians help you fast. 5. Don't lose control. Safety is sexy and prevents fractures. Great sex thrives on trust, comfort, and presence. Worries about STIs or pregnancy pull you out of the moment. And that's just the start. During vigorous thrusting, an erect penis can bend sharply if you miss the target and hit the pubic bone or perineum. This is how penile fractures happen. The classic signs: a sudden pop, immediate pain, loss of erection, and rapid swelling into an eggplant shape. That's a surgical emergency. Full stop. Do instead use condoms that fit and feel good. Try a few types with your partner to find the sweet spot. Guide the angle. Keep a hand on your partner's hips to control depth and alignment. Use plenty of lubricant. It reduces friction, protects delicate tissue, and feels amazing. If you suspect a fracture, go to the ER immediately. Timely repair protects long-term erectile function. Waiting can mean scarring and chronic ED. 6. Don't overheat the factory. Protect sperm and hormones. There's a reason testicles live outside the body. Sperm production likes it cooler. Long, frequent exposure to wet heat, hot tubs, steam rooms, long sauna sessions, heated seats, or a warm laptop on your lap can lower sperm quality and potentially nudge hormones the wrong way. Do instead moderate the steamy stuff, especially if you're trying to conceive. Keep a barrier between your lap and laptop. Better yet, use a desk. Pocket placement matters. Back pocket beats front pocket for phones and other heat sources. Prioritize breathable underwear when you'll be sitting for long stretches. 7. Don't train yourself on death grip. Don't outpace reality. Ultra tight, ultra fast, highly specific masturbation patterns can condition your arousal to sensations a partner can't replicate. The result? It's harder to get or stay aroused with someone else, even when you deeply want to. Do instead use lube and vary your touch, speed, pressure, rhythm. Occasionally practice in positions similar to partnered sex to keep your nervous system adaptable. Slow down. Add arousal cues, breathing, eye contact when partnered, fantasy, erotica that emphasizes connection, not just intensity. Make solo time shame-free. Pleasure thrives with relaxation, not secrecy and rush. 8. Don't smoke, then upgrade the rest of your lifestyle. Smoking damages blood vessels. Erections rely on healthy, responsive vessels. That's a direct, brutal collision of cause and effect. Smoking is also linked to bladder cancer and other life-changing diseases. Beyond smoking, the boring fundamentals outperform any secret hack. Do instead build a foundation. Move 4 to 6 days per week. Aerobic training supports blood flow. Resistance training supports testosterone and confidence. Eat mostly whole foods, quality proteins, colorful plants, healthy fats, and fiber. Stabilize blood sugar to stabilize energy and libido. Sleep 7 to 9 hours. Testosterone, mood, and recovery needed. Drink less. Alcohol blunts arousal and performance more than most people admit. Manage meds with your clinician. Antidepressants, antihypertensives, finasteride, etc. can affect libido, ED. Don't stop on your own. Adjust under guidance. Distress on purpose. Walking, breath work, journaling, therapy, or meditation. Chronic stress dials down desire and rigidity. Starter plan. Pick one upgrade per pillar for 2 weeks. Tiny wins compound. Your erections notice. 9. Don't beat yourself up. Break the anxiety loop. One off night does not define your masculinity or desirability. Performance anxiety creates a feedback loop. Worry right pointing arrow, difficulty right pointing arrow, more worry. The more you catastrophize, the tighter your body gets, and the harder everything becomes, physically and emotionally. Do instead treat yourself like a friend. You wouldn't trash a friend for one bad night. Don't do it to yourself. Reframe goals. Focus on connection and sensation rather than perfect performance. Communicate. Honest, non-defensive conversation with your partner reduces pressure and boosts arousal. Use mindset tools. Slow exhale breathing. progressive relaxation, or sensate focus exercises that rebuild confidence step by step. If anxiety, depression, or relationship conflict persist, involve a professional. The brain and body are teammates. Heal both. 10. Don't retire your erections. Smart practice preserves function. Use it or lose it isn't a perfect rule, but there's truth in it. Healthy men typically experience 3 to 5 nighttime erections that help oxygenate and maintain erectile tissue. If you're not having erections, awake or asleep, talk to a clinician. Letting sex go dark for months can make a comeback harder, not easier. Do instead keep sexual activity in the mix, solo or partnered, at a pace that feels safe. Aim for quality over pressure. Consider pelvic floor training to support rigidity and control, especially if you notice dribbling, premature ejaculation, or weaker erections. Maintain overall fitness. Blood flow is the backbone of erectile strength. If problems persist, seek evidence-based options, lifestyle upgrades, counseling, medications, devices, or procedural therapies, tailored to your situation. Momentum matters more than perfection. Practical red flags and green lights. Quick reference. Red flags: see a clinician. Painful erections or sudden curvature, ulcer, sore, or wart that doesn't heal. Discharge: burning with urination, or blood in urine, semen. Sudden pop, swelling, immediate loss of erection, possible fracture. Inability to retract foreskin or clean underneath. Ongoing loss of morning, spontaneous erections without an obvious cause. Green lights: keep doing it. Consistent, comfortable hygiene with mild products. Regular exercise, solid sleep, lower stress, moderate alcohol, open conversations about protection and pleasure. Lube use: more glide, less friction, better sex. Gentle, varied solo practice that mirrors partnered sensations. Final thought: your penis is part of a larger, beautifully integrated system: circulation, hormones, nerves, psychology, and partnership. Respect the system, and your results can improve faster than you think. Ignore the flashy shortcuts. Master the basics. Stay curious, ask for help early, and protect your future. If this helped, hit like, subscribe to Stoicism Drive, and share it with a friend who needs the straight talk. Got questions or a topic you want next? Drop a comment. We read every one and use your ideas to build the next videos.